Next, let me introduce you to Dr. Houda Sefiani. She is medical doctor graduating from Rabat University School of Medicine, Morocco, specialized in pharmacotoxicology and PhD in health vigilance field. She began her career as practitioner during 4 years before integrating the WHO Collaborating Center, Moroccan Poison Control and Pharmacovigilance Center. Since 2007, she has been working in pharmacovigilance activity and patient safety, focusing on cases analysis, causality assessment, signal detection, and risk minimization actions. She also has been involved in different training and development projects in collaboration with the WHO Monitoring Medicines Project, Uppsala Monitoring Center, and the Moroccan Pharmacovigilance Center to promote pharmacovigilance and patient safety in Africa and Middle East and North Africa region, developing new tools to manage adverse events. Since 2014, she has been member of ATC DDD WHO International Working Group. She will present her conference entitled Management of Patient Safety During COVID-19 Disease. We invite you to actively participate during this presentation. If you have any questions, please ask them in the chat on the right. We will be responding to as many as we can during the allotted time. The rest of the questions will be answered and published in our Q&A session within Patient Safety Day training on our webpage, isaponline.org. Without further preamble, please give a warm welcome to Dr. Houda Sefiani. Dr. Houda.
Thank you very much, Connie. Hi, everybody. Good morning to you, or good afternoon. Welcome to all to this online event. My name is Houda Sefiani, as said, and I'm working at the Moroccan Pharmacovigilance Center. I'm very pleased to be with you today and to participate to the World Patient Safety Day event. Thank you to the ISOP team and to the Colombian Pharmacovigilance for the organization. And thank you again for joining us. We are all here to celebrate the World Patient Safety Day, and this day was established last year to be celebrated annually on the 17th of September to recognize that patient safety as a global health priority and to increase public awareness and engagement to promote patient safety. For the launch, the WHO General Director said in his presentation that no one should be harmed while receiving health care, and all health systems must develop a patient safety culture to provide a safer care, and we agree totally with these points. As you know, this year the world is facing a particular health condition, and currently, when we think about patient safety, we are thinking about what could be the best way to ensure patient safety during this pandemic, this crisis period, this crisis situation with COVID-19. So the COVID-19 pandemic has suddenly challenged all healthcare systems, and the systems have had to reorganize instantly with the little time to reflect on the roles to assign to their pharmacovigilance and patient safety actors. I will talk about patient safety management during this period, given the Moroccan one as example. First of all, I would like to present briefly the Moroccan Pharmacovigilance Center and the role it plays in promoting patient safety. So, the Moroccan Pharmacovigilance Center have some geographical and cultural specificities. Morocco is a Mediterranean, African, and Arabic country, and we are the first African with South Africa and Arabic country who has joined the WHO International program for drug monitoring. Our center is a functional PV center, so we are dealing day-to-day, we are having day-to-day work on ADR and patient safety management with more than 50 people dedicated to this mission and more health professionals working in collaboration with the center to improve and to enhance patient safety in the country. As we are a country with limited resources, we developed an integrated vigilance system, which is a model for countries to manage all the ADR or adverse events, adverse drug reaction, or adverse event related to health products, to all health products, including medical devices, herbal, cosmetics, etc., and occurring in all circumstances. That means that it's occurred in normal use of drug, but also in the situation of medication error, of misuse, of abuse, and so on, and other situations. We are at the same time Pharmacovigilance Center and Poison Control Center and Drug Information Center for the population. This organization allows us to receive information directly from patients and to work closely with the population to enhance the patient safety culture and to ensure a safer medication use in our population. We have also a good experience in integrating pharmacovigilance within the public health program to assist them on ensuring patient safety and medication safety within the programs. In 2011, the Poison Control and Pharmacovigilance Center was designated as a WHO collaborating center in the pharmacovigilance and patient safety field with specific mission at regional and international level. For example, we have to, in our term of reference, we have to develop some training to develop pharmacovigilance and patient safety culture in French-speaking country in Africa, in MENA region, and in other region of WHO region. As you know, so after this brief presentation of the center, we will go through the topic. So as you know, the outbreak of of coronavirus disease, COVID-19, has created a global health crisis wide world. And on March 12, the WHO stated that the COVID-19 is a global pandemic. Since then, all countries have strengthened their efforts to improve their surveillance system to quickly diagnose cases and to find an effective and safe way to manage and treat COVID-19 patients. In parallel, all pharmacovigilance systems, the ultimate objective of which is to ensure patient safety, faced a big challenges during this period to be able to reach the goal of ensuring patient safety and to keep the cap of patient safety in their countries during this period. The COVID-19 responds clearly to the WHO crisis definition, which is any unplanned event which lead to the interruption or to the destabilization of the normal operation or activities of any health organization. And now we are facing this situation. We are facing an unexpected health situation that requires a specific crisis management to respond rapidly and forcefully to minimize the patient harm within the health system. And it is the aim of any pharmacovigilance system. We found out in this period most of the known crisis characteristics. The time was short to develop a new drug or vaccine, and the health system have turned to existing drugs with potential or sometimes with hypothetical therapeutic action, despite the lack of information concerning the safety of use in this indication. As we know, the COVID-19 disease is with the high contagiousness and virulence, and decisions were required urgently So we have the countries has to decide urgently and to give the population an effective drug, even if there is a lack of information about the safety of use and etc. We can add to this criteria the loss of control from people with fear from future. So in Morocco, since the first case detected, the health ministry put in place an action plan to manage the crisis, and the Pharmacovigilance Center was involved since then to assist all the stakeholders at each level of the management plan to assist them to put in place some action to ensure patient safety within this general management plan. And specifically, the Pharmacovigilance Center set up some pharmacovigilance proactive action. These actions were developed according to the knowledge we had, because we are working in Morocco since more than 30 years. So we have a knowledge concerning the population, concerning the health system, and concerning the risk we expect according to our knowledge in our population regarding the irrational use of drug, regarding the use of herbals, and the increase of self-medication, etc. So we were able to expect what can happen and to be proactive and to act preventively with the population. So we started with a general public awareness, raising measures to avoid irrational use of drugs and health products during the lockdown period, with the increase of a risk of the use of herbal associated with drugs, and also the risk of the increase of self-medication, because we can predict this increase in our country. We are facing self-medication in normal time, so we expected that we will have more self-medication during the lockdown period and during the pandemic period. So we addressed awareness message especially for patients treated for chronic illness like diabetes, hypertension, using chemotherapy for cancer, etc., and specifically to raise awareness about the risk of the use of herbal with the drugs, with all the risk related to drug interaction or drug herbal interaction. So it was we did a lot of campaign to raise awareness of public about the risk related to these practices. We also raise awareness about the risk of irrational use, specifically for some drugs like anti-inflammatory drugs, paracetamol, and vitamin D. For this specific drug, the risks were identified all over the world during this pandemic. So when it was really problematic that all the population used vitamin D without prescription because there was a lot of media sensitization about the protective effect of vitamin D, for example. Throughout this period, the Poison Control Center has received several calls concerning the use of plants, drugs, and even the risk of the use of disinfection, the gel to disinfect, the hydroalcoholic gel. We have seen a real change in the subject of calls, whether from the population or from the healthcare professionals. So there is a change of the type of calls we received via the Poison Control Center during the pandemic. But the result, we will have it after the pandemic to be able to compare correctly with before and after the COVID-19. We kept our sensitization campaign near health professionals on the importance of the adverse event reporting, because we need to know what happened in our population, and to remind them what is the best practices rule for prescription and also for the patient's follow-up. Because during the lockdown period, we stopped all activities, so it was very difficult to do correctly the follow-up of the patient, to do correctly the prescription, etc. To this end, we used all the tools we found to be close to the population and to healthcare professionals. So we used media, social media as communication tools to reach patients and also to reach some healthcare professional using, for example, a direct channel of the Ministry of Health to reach directly healthcare professional. After that, it was the proactive part before starting doing the ensuring patient safety for the COVID-19 patient. On March 23, the Moroccan Ministry of Health, as many other countries, allowed the use of hydroxychloroquine and chloroquine in association with azithromycin for all patients. All COVID-19 patients in hospital. Now it's changing. Now we give this protocol, the same protocol, at home to all positive patients with PCR positive with COVID-19. To support the implementation of the treatment protocol and to ensure the rational use of drugs and patient safety, the Pharmacovigilance Center developed documents with some recommendations for healthcare professionals regarding the safe use of those drugs. This document summarizes the guidance of the use to avoid a known ADR that we know that it can happen with hydroxychloroquine, with chloroquine, or with the association with azithromycin, and also regarding all the comorbidities, risk factor, drug-drug interaction, etc. So it was a general letter was sent with the clear description of the most known frequent ADR reported with the selected drug by the ministry in the protocol. The health professional received from the center all the information with preventive action to avoid ADRs, but also with corrective strategy in case of occurrence of ADR. The first document was developed with the involvement. It wasn't developed only with pharmacovigilance team. It was developed with the involvement of all clinical experts in the country. The document included the list of associations with high risk of occurrence of drug-drug interaction with the risk of occurrence of ADR in patient COVID-19 or in specific population like a diabetic population or other specific pediatric or breastfeeding population or pregnant women, etc. Also, to continue our work of collecting adverse drug reaction, an adapted ADR reporting form was developed and displayed in all health facilities taking in charge COVID-19 patients. I want here to highlight just that the fact that the management of the risk associated with the use of medicine, of drugs, or medical products require a close and effective collaboration between the key player in the field of pharmacovigilance and patient safety. Sustained commitment to such collaboration is vital during the crisis context. That means that if we didn't receive information from a healthcare professional who are in front line with patient, we are not able to do something in pharmacovigilance. So it's necessary to keep this strong collaboration with all the stakeholders in the system. On the other hand, as you know, usually for any new drug or new indication for known drug, the drug regulatory agency normally requests a risk management plan from the pharmaceutical company for a drug approval. In the situation of COVID-19, the health ministry recommended a new indication, a new off-label use. So it was off-label use of chloroquine and hydroxychloroquine in the new indication. So in Morocco, the Pharmacovigilance Center imposed to itself to develop a risk management plan to assist the Ministry of Health and to follow the efficacy and also the risk related to the use of hydroxychloroquine and chloroquine in this context. So it was developed by the center, and this risk management plan includes all the parts normally that we found in the risk management plan, an overview of the product with pharmacokinetic and pharmacodynamic characteristic, the safety specification of the safety profile, important identified risk, important potential risk, and missing information regarding the use of this drug in this indication, and also the use of this drug in association with other drugs that can increase the risk of specific ADR. Also, in the risk management plan, we developed a part regarding the pharmacovigilance activity and risk minimization action, and the risk minimization plan that will assist the use of this drug during the period. This pharmacovigilance plan within the risk management plan contains all the proactive action, including, of course, the spontaneous reporting and also an active surveillance. The risk minimization plan includes proactive preventive action to avoid or to decrease a known risk. For example, in this protocol, we use hydroxychloroquine with azithromycin, and it's well known that hydroxychloroquine have the risk to induce it's a torsadogenic drug, so it can lead to the prolongation of QT interval, and the association with azithromycin can lead to the increase of this risk in patients. So we proposed some additional cardiac monitoring, cardiovascular monitoring, to avoid the occurrence of this specific ADR. So the risk management plan was adapted to the use of the specific drug in the specific situation with specific other drugs. So many other recommendations regarding known and identified risk were proposed, and also some action to identify a new signal and to identify new safety information. After that, we start to receive ADRs related to the use of drugs, and following that, we receive cases, and all cases were analyzed following the PV process. So for the process of pharmacovigilance, all cases in pharmacovigilance involve several distinct steps, such as we collect data on cases, potential ADR. We analyze all cases. After we detect if any of new signal or have arisen, decision if action is needed to optimize the safe and effective use of drug, and then we have to communicate this action or this recommendation to the users. It is also important to follow up the actions taken to see if it has been effective or not. So the signals were detected during the COVID-19. We collect information regarding the ADR and adverse events occurring during this period after the use of hydroxychloroquine and azithromycin in patient COVID-19. And Some signals were detected using the qualitative method because at this stage of the pandemic, the number of cases reported is not that high to apply data mining or to detect signal using a quantitative method that's based on statistical disproportionality calculation. So we used the qualitative method, and some signals were detected during this period. So all detected signals were analyzed, and a root cause analysis was performed to find out the cause, why it's happened, and what is the contributing factors to the occurrence, and all signals were evaluated according to the impact and the likelihood of and to quantify the risk to decide which action to put in place, what is the adapted and targeted action to put in place to decrease the risk of reoccurrence of to decrease this risk in patient COVID-19. So we detected two signals on preventable ADRs, and the first one was related to medication error with azithromycin, and some patients took 3 times a day 500 milligrams of azithromycin, and this dose increased the risk within the combination with hydroxychloroquine. So it's well known that the association can lead to increase the risk of QT prolongation, but with this patient with the medication error, the risk was higher. So we received some cases of QT prolongation, and the analysis of these cases shown that it was a medication error. The second signal was related to medication error also, but it was drug-drug interaction between hydroxychloroquine and some diuretic antihypertensive that can lead to, and we received some cases with hypokalemia that can lead to a cardiac problem, but all the patients presented only hypokalemia. So for those two signals detected, we proposed a targeted reactive action, and we put in place some recommendation to decrease this risk. So, for example, we sent a letter with recommended action to avoid a medication error with azithromycin, and we proposed to give a patient a daily dose each day, so to avoid this risk that he can take 2 or 3 times azithromycin instead of 1 time a day. So in pharmacovigilance, the pharmacovigilance in Morocco plans to continue, of course, the patient surveillance after COVID-19 pandemic, and we plan to follow all treated patients, and especially patients with comorbidities and specific population like pediatric population, pregnant or breastfeeding women. In addition, we are analyzing a database more deeply, and we continue to collect information about the drug, about the ADR, about the use of drugs during the pandemic, and we will see what we will detect as signal after analyzing the database. In conclusion, we learned from this crisis that every situation is different, and there is no one-size-fits-all responses. The pharmacovigilance must put in place a mechanism to deal with the issue. It must be flexible enough to respond to changing events. Things change rapidly, and pharmacovigilance response must be powerful, targeted, and aimed primarily at protecting the public health and promoting patient safety. And thank you for your attention.